When I got started in dentistry, I didn't even know what I was getting into. And before you know it, it became a daily drudge, confined to what everybody thought dentistry was about from their parents' and their grandparents' age. It got dull, it got boring, and we just got away from it. And people walk in and they look around and they say, am I in the right place? People feel like they're sitting in their living room and having a conversation. And we sit on the same side of the table and we try and figure out, what do we need to do? Let's get creative. Let's figure out a simple way to get it done. Now, it's not easy, but we're going to make it simple for you. I've been doing dentistry for over 30 years now. My wife jokes, my kids joke, I'm on a plane a lot, traveling all over the country, taking courses, giving courses, figuring out what needs to be done, staying right on top so that we can be on this cutting edge and bring to our clients exactly what they need. I handle people with bite problems, I handle people with cosmetic issues, and I handle problems with the tough cases. And then people come in and we just go to work at fixing them up. A woman came in and we treated her all day long. About 3, 4 in the afternoon, we get a phone call from the woman apologizing. Gee, Doc, I'm really sorry. I never had this happen before. I just woke up. I missed my appointment. I don't know what happened. I just slept right through everything, and it's 3 o'clock in the afternoon. What should I do? Take a look in the mirror. And she says, oh, my God, was I there? And it was done. They're not asleep. It's what we call oral conscious sedation. They're awake enough that if they had to get up and go to the bathroom, they could. But we can go to work and do whatever they need done. And the next day, they barely even remember being in the office. Pain. People don't even want to hear the word pain. They don't want to hear the sound of the drill. They remember Little Shop of Horrors with Steve Martin, Papillon with Dustin Hoffman, some idiot dentist when they were a kid who put their knee in their chest. And they worked on them, and they told the dentist that it was hurting, and he didn't stop. They don't trust. They don't trust. We used to joke that we ran the nitrous oxide through the air conditioning units. No, we don't really do that. Between the nitrous oxide and the pills that we're able to use, getting people numb before they get the injections, there's no reason to have any pain while we're working. And then afterwards, I just don't get it. And I don't pretend to understand it. 9 out of 10 people tell me I didn't have to take anything afterwards. Maybe Tylenol, a little Advil. I was fine. Some people are concerned that they're going to come in and they're going to be embarrassed. You can't put them down. You have to work with them. I'm there to help them. They're too busy beating themselves up. I don't want to beat them up. And they say, gee, I really have not been happy with the way I look. I can't look at my wife. I'm embarrassed. I'm afraid to go out on a date. I hold things back. People think I'm grouchy at work. I hide my smile. I hold my finger and my hand over my mouth. People think I'm snarling at them, but I'm just covering it up because I'm embarrassed. You know what? You're really not alone. You're really not alone. There are things we can do. Let's talk about your expectations. Let's talk about the time involved. Let's talk about the results and what do we have to do to get you back in shape, and it finishes with a beautiful smile.